Welcome to AudioScholar. Today we're summarizing Making an Impact on BP, Why Pills Alone Won't Win the War, from NephJC. Hypertension is a massive global health problem, and its control remains a major challenge, particularly in low-income and underserved communities. The disease is often silent, and non-adherence to therapy isn't a character flaw, but a consequence of social determinants like poverty and lack of resources. Factors like clinical inertia, the failure to intensify treatment when blood pressure is high, account for a large percentage of treatment failures. Past research has shown that single-level strategies, like simply training providers, don't move the needle. However, multi-component, team-based approaches have shown promise. The IMPACTS BP trial was designed to test if such a comprehensive strategy could successfully lower blood pressure in the uniquely challenging environment of federally qualified health centers in the United States, which serve a high-risk, low-income population. The study, IMPACTS BP, was a cluster randomized trial conducted in 36 federally qualified health center, or FQHC, clinics across Louisiana and Mississippi. Clinics, rather than individual patients, were randomized to either a multifaceted intervention or enhanced usual care. Population. The study enrolled over 1,200 adults aged 40 or older with uncontrolled hypertension and high cardiovascular risk. The population reflected the communities served by FQHCs. The mean age was about 59. Nearly two-thirds of participants were African American, and almost three-quarters reported an annual family income below $25,000. Methods. The intervention was a team-based strategy targeting the system, provider, and patient. The clinical goal was intensive blood pressure control with a target systolic blood pressure, or SBP, below 120 millimeters of mercury, guided by a protocol adapted from the SPRINT trial. This involved frequent follow-up visits to reduce therapeutic inertia. The implementation strategy included team-based care with physicians, nurses, and health coaches. All intervention patients received home blood pressure monitors. Health coaches addressed medication adherence, lifestyle changes, and social barriers to care. Providers also received regular audit and feedback reports on their patients with uncontrolled hypertension. The control group received enhanced usual care, which included a webinar on hypertension guidelines and training on standardized blood pressure measurement, but no other implementation support. Results. The primary outcome was the change in systolic blood pressure over 18 months. Primary outcome. Both groups saw a substantial drop in blood pressure, but the decline was significantly greater in the intervention arm. Mean SBP decreased by 15.5 millimeters of mercury in the intervention group compared to 9.1 millimeters of mercury in the enhanced usual care group. This resulted in a net between-group difference of 6.4 millimeters of mercury, a clinically meaningful improvement. This benefit appeared within the first 6 months and was sustained. Other findings. Secondary outcomes also favored the intervention. For example, 48% of intervention patients achieved an SBP below 130 millimeters of mercury compared to 36% in the control group. However, it's notable that fewer than a quarter of patients in the intervention arm actually reached the aggressive target of SBP below 120. Interestingly, while treatment intensification and home blood pressure monitoring were much higher in the intervention group, self-reported medication adherence did not significantly differ between the two arms. This suggests that the system-level changes, rather than patient-reported adherence alone, drove the blood pressure reduction. Finally, there was no significant difference in serious adverse events like hypotension or falls between the groups. A key challenge identified was sustainability. Even within the structured trial, completion rates for both provider and health coach visits declined significantly over the 18-month period. The main clinical takeaway from IMPACT BP is that a structured, team-based, multi-component intervention can significantly improve blood pressure control in high-risk, underserved populations. The success of the intervention was not about a new drug, but about redesigning the system of care, measuring blood pressure carefully, reviewing it frequently, and acting on it aggressively with team support. The fact that the control group also improved by over 9 millimeters of mercury suggests that even basic, focused medical attention is therapeutic, and highlights how much routine care may be falling short. This was a summary of a single, albeit large, clinical trial. The intervention was a bundled package, making it impossible to know which specific component was most effective. Furthermore, the intervention was resource-intensive, and its long-term sustainability and cost-effectiveness in real-world settings without trial funding remain significant questions. That was a summary of Making an Impact on BP. Why Pills Alone Won't Win the War, from NephJC. For the full piece, visit the original source. Until next time.